My name is Cassie Sear, and I chose to do my second career profile on a community health educator. Community health educators typically live in the community that they work with and serve, and they can work in a variety of different places, such as colleges, doctors' offices, and hospitals, private businesses, as well as government and nonprofit organizations. Community health educators typically work full time and will usually travel at some point from place to place for different events. Some common job tasks of community health educators are they advocate for the people, so they bridge the gap between social services and healthcare and the people in the community. So they go to and they also run community events to educate the public about different health concerns. This can be anything from preventative care or treatments, diabetes, sexual health and abstinence, prenatal care, alcohol, anything of that nature. They also promote wellness and will teach the community members where they can access resources that are available to them, such as health care and insurance, housing, food. They may also do home visits, drive clients to appointments. They do a little bit of counseling. Some typical stressors that they might encounter are traveling. If you're traveling from place to place, different commutes. If you become too involved with a specific community member, that can take your focus away from all of the other members who you are trying to reach. This is a relatively new career field, and so it may be hard to find a job, as a lot of employers don't quite know yet what community health educators do, what is in their scope of practice. They may not know how to utilize them. And some jobs may be temporary. Different health initiatives that you're working on, when they're finished, you'll have to find a new job, whether that be just a new project to work on or a new employer to work for. So that can be kind of stressful, jumping from job to job. The typical the educational requirements to become a community health educator is you need to at least have a bachelor's degree. Some jobs may also require a master's degree as well. And many states and employers are also requiring you to get a certified health education specialist credential, and they may also require ongoing education. But they may also, depending on your employer, they may also pay for that ongoing education for you. The starting salary range for a community health educator is around $35,000. And then there's definitely room for advancements, and those more experienced people can make $42,000 up to $60,000 or more, depending on their job. And those would be people who become supervisors or community health managers. Typical benefits of a community health educator, depending on the employer, who you work for, where you work, the city, you can expect good health benefits, paid time off, 401k match, and then some miscellaneous information about the field of community health education. It has a faster than average growth rate. So that's very good. There's definitely room for advancements. Community health educators can also go by a variety of different names depending on where you work, who you work for, and the job tasks that you're specifically working on. Some other names that they might go by, for example, are a health coach, a family advocate, a liaison, outreach worker, peer counselor, public health aide. So when you're looking for jobs, you can also look under those different types of names. If you would like more information on becoming a health educator, my resources are the ExploreHealthCareers.org, CommunityHealthEducators.org, BLS.gov, and HealthCareCareers.org.